Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office here once again, bringing you the numbers from the last 24 hours, joined with Chairman Mark Kern and Sam Behrman from the Health Department. And after we get the numbers, we'll be taking some questions and answers.
Yes, thank you again for having us. We are happy to be here. And as we have done in days past, the numbers that we will announce today are St. Clair County residents that have been tested. For today, we have 1,679 St. Clair County residents that have been tested. We are at 389 positive test results, which is an increase of 7 from yesterday, and that includes both males and females from the ages of 20 all the way up to the 80s. We are at 1,181 negative test results, with 109 test results still pending. We are still currently at 22 deaths. For state totals, we are at 214,952 people that have been tested, with 43,903 positive test results, which is an increase of 2,126 from yesterday. And we are at 1,933 deaths for the state, which is an increase of 59 from yesterday. And as always, our condolences and thoughts and prayers go out to the families who have lost loved ones to this virus. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, we have 67 patients that are admitted for COVID reasons, and 6 of those patients are on ventilators. For our long-term care centers that are currently in outbreak status, and that means 2 or more staff or residents that are either COVID positive or who have COVID symptoms. The first is Bria of Belleville with 12 positive cases and 1 death. Colonnade of O'Fallon, which has 2 positive cases and no deaths. Four Fountains in Belleville, which has 24 positive cases and 1 death. Memorial Care Center in Belleville with 15 positive cases and 1 death. St. Paul's Home in Belleville with 5 cases and no deaths. And Lebanon Care Center in Lebanon, which has 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So today we're going to be taking questions and answers, so I'm just going to go right into the zip code report to make more time for that part of the program today. So as far as zip codes go, remember, if your zip code is not named, that doesn't mean you don't have any COVID positive diagnoses in your zip code. What it means is that it hasn't risen to the level of 5 yet. But this is becoming less and less an issue because we're adding another zip code today. We're seeing the spread continue, and at one point, I'm afraid, every zip code in the county will be part of this report. 62201 remains at 10, and 62203 remains at 13. In 62204, there are now 12. That's an increase of 1. At 62205, there are 14. That is an increase of 1. In 62206, there are now 39. That is an increase of 4. In 62207, there remains 22. In 62208, there remains 25. In 62220, there are now 41. That is an increase of 6. In 62221, there are 34. That is an increase of 3. In 62223, there are 26. That is an increase of 3. In 62226, there are 56. That is an increase of 1. In 62239, there are 6. That is our new zip code. Once again, the new zip code is 62239, and there are 6 COVID positives in that particular zip code. In 62254, there are 11. That is an increase of 1. In 62258, there remain 12. And in 62269, there are now 36. That is an increase of 2. And so we'll now head over to the host of this program, Mr. Herb Simmons.
Well, thank you, Chairman. And then you said it right. The numbers go up as zip codes. If it keeps going the trend that it's showing, well, probably every zip code will have the numbers in it, and I think that just reinforces what we've been saying. As we said, on Sundays we try to do a question and answers to try to recap what's been going on for the past week. We're joined here again today with Assistant EMA Director Brian Whitaker, who has been fielding those questions, and I appreciate everybody who submitted their questions last night, and we'll try to answer as many of them as possible. Brian, welcome again today.
I'm sorry, Director Simmons, before we go any further, can I make one clarification about the numbers that
You can do whatever you
stated
want.
for the county? As some of you who follow daily would notice that we only had 7 positive cases today. Keep in mind that we do have 109 cases still pending, and so just because we have not had as many positive test results today as we have in the past, that does not mean that we have hit our peak. It simply means that as we have opened up more testing sites, the labs have been inundated with more test results, and sometimes those test results will take a longer amount of time for us to get those results. So with 109 test results still pending, just because we only have 7 today does not mean we've hit our peak. So just to keep that in mind with our daily numbers that we gave to you today.
Very good. Thank you. Brian, thank you.
Sam, we'll start down here with a question for you. Are any of our local hospitals using plasma as a treatment method?
Not that we are aware of right now. There are some hospitals in St. Louis that are part of a trial study, but over in our area, St. Clair County, not that we are aware of.
Okay, thank you. Second question that came in is, how will the executive order affect farmers markets, such as the open air outdoor markets like the downtown Belleville farmers market that happens on weekends, and also the Swansea farmers market? Originally they were scheduled to open in May. Do you anticipate this being pushed back into June?
We're going to have to wait until we receive the final order for the governor's declaration. And no one, unfortunately, can see into the future when it comes to what's going to happen with coronavirus. So as soon as we have that information and as soon as the governor's declaration is out in final form, we'll be happy to share what we know about that with you.
Well, I think it's good to clear that the farmers market that's on 159 in Belleville, the store, is open. We're talking about the pop-up
Correct.
Farmers market.
Yes, the ones that are happen in areas where there are multiple stalls and people walk from stall to stall looking for items.
Correct. Thank you.
Okay. Director Simmons, a question for you here that says, for businesses attempting to protect their employees with the new regulation that a mask must be worn indoors when you cannot maintain that 6-foot social distance, what can be done to properly identify subjects wanting to purchase things like alcohol and tobacco that require identification?
Well, and that's a good question, and I think that's going to be left up to the individual business. You should have a policy or a procedure that your management is put in place, but also keep in mind if you're behind the counter and if someone comes up and they're wearing the mask like they've been required to, you can ask them to step back, get away from that, to that 6-foot distance. Ask them to pull the mask down if you have to do that. And if they don't, you have the right not to serve them if you don't want to. But I'm hoping that everybody will understand the purpose of that. But again, I would check with your management and propose that question to them. How are you supposed to handle that?
Thank you. Another question that came in for you, Director. Will DMVs open back up specifically for truck drivers?
I don't think that's been addressed yet. We're hoping that will be in the new executive order when we get it. I know the DMVs, a lot of their license and that has been extended for 3 months if you're having to have renewals, but I don't know of anything specific to the truck drivers yet. But if once we get that, we'll post that up.
Okay, thank you. Chairman Kern, are there any plans to support a Southern Illinois congressman in an effort to open Illinois in regional format?
So we've got to remember this virus. This is something new. It's a novel virus. These things are ever changing. The advice is ever changing. Earlier we talked about plasma. The way that works, someone who's had COVID has to have gotten over it for a period of 28 days, and then they take their blood and they make the plasma from that. They can only treat 2 or 3 other people, and they're not sure that works yet. We have really just embarked on this, on COVID-19 in our county. There are probably very few people who have gotten it out of their system for that long. So until time takes its toll and we can figure out where we are, treatments like that may not be out there yet. That being said, if there is discussion going on about loosening up restrictions, we talk weekly with our legislators, with our senators, with our congressmen. We had Congressman Bost on Friday. All of that advice and all of their views certainly need to take into account recommendations from the medical community. We assume when things open up, it's going to be done with science telling us to do it. It's not really a political decision. It shouldn't be a political decision. It should be a medical decision.
Thank you, sir. And kind of to follow up on that question, is the county prepared to enforce stricter rules than the state guidelines if it would be necessary to keep people safe in this area?
So, we've seen our numbers, and Sam talked about today's number being at 7. So we've increased over 100 from last week at this time. And last week at this time, we announced that we were 122 over what it was the week before. So this thing continues to grow. One of the things that really concerns me, though, and where we've got to look at existing guidelines to make sure they're enough, is the growth that we've seen in our long-term care facilities. That is one thing that scares me. These facilities, we've got to make sure that everything is there to make sure that this spread does not continue, because that seems to be a real danger point. It is a hot spot, is what it's called by their state officials. We want to make sure we keep those to a minimum in St. Clair County.
Well, I think that's fair to say, Chairman, that the stricter enforcement, the executive order, when we get it, we'll have that all spelled out in there. But that the county is prepared to educate what we've been doing every day to our citizens to adhere to those type of restrictions, because that's the only way we're going to get this thing opened up quicker.
Thank you, sir. Next question is for Sam. If you have tested positive for the virus, can you get it again?
So for those of you who have watched some of the briefings before today, we've had a couple physicians from local hospitals that have been here. And while we are learning more about COVID-19, which is a new strain of coronavirus, there is still a lot that we don't know. And these physicians have said, we think we might know this, but it's only time is going to tell. So at this point, we're going to take any, information that we got from our physicians regarding that. Right now, they don't think so, but that isn't a 100% certain statement. That could change as this virus evolves.
We know, Sam, and I think to follow up on that, the way things are changing. When this first started, it was ventilators, putting these people on ventilators. We heard the physicians on here now saying that they are actually testing other methods of like high flow to oxygen through nasal cannulas.
Yes.
So this is a ever-changing learning experience for those physicians. So
Exactly.
That's you're right on target with that. So it's to answer that question, I don't think anybody knows. They're still trying everything.
There is still quite a bit to learn about this virus as we continue forward.
Okay, thank you. Another question for you is, are the hospitalization numbers that you announce each day those who reside in St. Clair County, or is it specifically patients in St. Clair County hospitals, regardless of where their home of residence is?
So the numbers that we report to you for hospitalization of patients are of patients that are in St. Clair County hospitals. They may live in another county, but they are currently hospitalized in a hospital that resides in St. Clair County.
Okay, thank you. Sticking with the question about the hospitals, we had one come in that said, how many ventilators does each hospital have?
So as our St. Clair County is, we are part of the Illinois region of hospitals, and we share assets through all of those hospitals. And as a region, we have 138 ventilators that are part of those assets that we can share from hospital to hospital depending on the need of the hospitals at that time.
Well, Sam, and I think it's fair to say that because of the proactive approach that the hospitals have jointly took together along with the county, those that equipment has been accounted for, and as you said, they're able to share that from hospital to hospital. So our hats go off to those hospitals and to the health department for staying on top of that. You see across the country where there was a lack of ventilators, and we are just really fortunate to be out in front of this is the way we got out of it.
We have, and we've got a great working relationship with the hospitals in St. Clair County. So we've been able to keep in contact with them, communicate with them as to what their needs are, and if there's anything that we can be doing to help them and support any equipment needs that they have. We've been able to help with that.
Very good.
And you actually helped with recalibration equipment, isn't that right?
Yes, they had a situation, and we were able to even reach out to the Army Corps of Engineers and National Guard people to get that stuff set up for them.
And that was for ventilators?
Ventilators, yes.
Okay. Director Simmons, next question comes in for you. Will local sheriffs and police enforce the requirement of face coverings beginning May 1st? There are counties in the state that said they will not enforce it.
Well, I can't speak for the law enforcement other than we've got a good working relationship. We have the conference call with them every week, and everybody has been on board. We just had the Fairview Heights chief on yesterday. We had the Swansea chief on a week ago, and the ones that we've talked to, and it's all educational. And everybody we've talked to, if they get a complaint, they're going to go out there and try to reassure that person the seriousness of this. And I go back to what the sheriff, Richard Watson, said when he was on here many weeks ago. It's about educating the public, but if they insist on needing a place to stay, he has a place for them to stay. We don't want that. We want everybody to help be a part of that solution.
Okay. Another question to that effect for you. The person writes, will you please ban dispensable beverages, as there are too many people coming in and out of gas stations just to get a soda or coffee that are putting people unnecessarily at risk?
Well, unfortunately, the executive order, the current one, doesn't spell that out. We'll see if that gets addressed in the new one. But again, that is a business-to-business decision. If you're an employee at one of those such locations, I would be definitely addressing that with my management. I stopped at a fast food McDonald's on the way in here to get a drink, and they've got the plexiglass up where they're passing stuff out. The person taking the money had gloves on, had a mask on, and as I looked through there, I could see they were all like that. So each business should be practicing that best practice. So for the person who is that question, if you're an employee at one of them locations, talk to your management about it. And then we've also got we'll put up a number later on a COVID line that you can call. And if you want to make complaints or get answers, we'll make sure that gets posted for you.
Okay, thank you. Chairman Kern, next question is, does a mayor decide if parks and splash pads will be open?
So the executive order says that that splash pads and swimming pools are not allowable. A mayor can keep their parks open, and many have. St. Clair County has kept our parks open, our trails open, and that'll be that way until the public shows us that they can't handle the rules of not gathering and staying 6 feet apart. So far, so good. Everybody really is respecting the executive order, the recommendations. So people use the parks to go out and stretch their legs, and we encourage that. Mayors have the power, of course, to be more restrictive than the executive order. They could close their parks if they need to. Several have playground equipment that attracts groups, and so they have actually roped off the playground equipment. But it seems that most now are kind of reopening the parks, allowing people to get out and stretch their legs. And being cooped up is not a good thing, and so allowing people a place to go, giving them an opportunity to enjoy themselves. We still have to remember we got to all be able to enjoy our lives, and parks are a big part of that enjoyment.
Well, Chairman, I think it's worth mentioning also, we've had some of the local mayors on. We had the mayor of Muscuda, the mayor of Marissa, the mayor of Fairview Heights, and they've all indicated that even though, like the mayor of Fairview has opened up the dog park, and he made it very clear that they are going to be monitoring that, and if there is any abuse that takes place, he has no problems of putting that ban back on. And so, it's all about being responsible.
Chairman, one of the most popular things you do every day is the zip code report. People are eagerly awaiting that every day. And one of the questions was, how does that report work?
So I wish I was that popular at home, but the zip code report works that if there's a zip code that has more than 5 people in that zip code that have been tested positive for COVID-19, then that particular zip code is allowed to be reported. These are guidelines that are put forth by the state, by the Illinois Department of Public Health, that tells us that we have to abide by certain HIPAA rules. One is the zip code rule of 5 or more. So that's why we report every day. We had a new one today. We continue to see significant growth in these zip codes. I think people look forward to that report because it localizes COVID-19 even more than a general countywide report or even a statewide report.
Well, and I think it's, in all transparency, it took a lot of pushback to get us to be able to do that. I mean, for several weeks we had people asking that was following the page, and thanks to you and working with some of the state representatives up to IDPH, we were allowed to start doing that. So thank you.
And one follow-up to that, just for clarification, one of the questions that was asked on the live briefing here today was talking about how we only announced 7 positives, but there was more of an increase in zip codes than those 7. I think it's important to know, as you've said before, the IDPH releases those zip codes daily at 2:30, and those are the numbers we announce. Sometimes it takes IDPH a little bit to get caught up, so they could show a bigger number in the zip code than possibly what's announced that day.
So the gathering of these numbers is tricky. You see Sam here, for 10 minutes or 15 minutes during the day. The rest of the time, and the other 23 plus hours in the day, these numbers are being calculated and gathered. There are people from St. Clair County that are currently in a hospital in St. Louis or in many other locations that are not in our county. IDPH gathers a lot of those numbers, and the lag between Sam gathering the numbers from all our local hospitals, our local testing centers, all the places that now are inputting information, sometimes doesn't necessarily coincide with IDPH. They catch up within a day or so, but every day, if you add the numbers, sometimes they don't always jibe.
Okay. Thank you, Chairman. Sam, the next question's for you. Is it true that hospitals get paid to report a death as COVID-19?
So that type of information, we've had that question come up before. That type of information is not shared with us, so we don't have that answer for you.
Okay. Next question is, how many of our positive cases do we not know the source of contamination, or what percentage of the spread is between families and friends?
So the first few cases that we reported as positive COVIDs were either due to international travel or direct contact with someone who was a COVID positive patient. But over the past, my goodness, probably 3.5, close to 4 weeks now, we have most of our patients, well, I would say probably majority of our patients now are all COVID positive due to community spread, which is someone around you that has had the virus and that is positive, whether they know they're positive or not, transferring that virus to someone else.
Okay. Next one says, I was hospitalized for a week with COVID-19-like symptoms, but I tested negative. When will we have the antibody testing to find out that if I indeed contracted the disease?
We also had that question on a briefing, I believe it was earlier, at the end of last week. The antibody testing right now is currently not FDA approved, but as soon as the FDA does approve that, we will be happy to bring that information to you and share it with you on where the antibody testing can be performed.
Okay. A lot of health questions, so I'm going to throw
Yes.
another one right
Sure.
at you here. It says, many people are asking about public and private swimming pools and swimming clubs. Can they make their own decisions to open? Some have already indicated they will stay closed, while others remain optimistic.
While public gatherings still remain off limits, if you have a personal pool at your home, you are free to open it, although the weather has not quite cooperated at this point to open your pool. But you are able to open any home pools you have, but please keep in mind that opening your home pool should be and it should be used by only people in your household, in your family that reside at that house. Please don't be having neighbors or other family members that live outside the home over. Kind of defeats the purpose of, our sheltering in place and our social isolation. But those that have home pools are free to open them up when the weather permits.
Okay, thank you. Director Simmons, a question came in about the daily briefing saying, would it be possible to get a business owner on to talk about how the pandemic is affecting them from a restaurant or small business perspective?
Yes, we've actually been talking with a few of the business people, and as you know, if you've been following us, we've had the economical development, Mr. Stubblefield on a couple different times. We're working on somebody from the grocery industry. We had a suggestion came in late last night while I was answering questions about having a dentist come on. So yes, we are wanting to reach out to those operations to come in and just let them explain their impact. We talked about the local movie theater possibly. So yes, that's a good question, and we are working towards that.
And you had Wendy on from the Belleville Chamber of Commerce.
Yes.
Wendy spoke about how this was impacting local businesses, but I think that's a great suggestion.
It is.
Another one that's just come in live here on the feed is, what about hairdressers? Do we see any indication that they could be able to open soon with a limit on the amount of customers and or employees in the building?
Well, I'd like to get my barber open back up. A bunch of us would. But I've also seen a bunch of the things on social media where they're standing back with a 8-foot broom handle blow drying somebody's hair and with a mop standing back. So I don't know how that's going to play out. I don't know how you practice social distancing, cutting somebody's hair or doing that. So that's a good question. I know we all would like for it to be opened up. But I think safety and health has got to come first. So we'll wait and see what comes out in the essential businesses in this next order.
I know a hairdresser whose husband is COVID positive, and she wouldn't have known. She might not have symptoms. She hasn't contracted it yet, but the spread, that's an easy way to spread. When you're in a beauty shop or in a barber shop, you're just close together.
Yeah. And there's been all kinds of suggestions. Well, they only take one customer at a time, make the other one stand outside. But, I mean, you still got them coming in, and how do you get that close and cutting their hair? And when you got a mask on, how do they cut your hair with the mask on? So, I mean, it's a lot to work out. But
That's why it's nice not to have a whole lot of hair.
Okay, thank you. Another question that's come in here on the feed today is, Sam, as the health department, can you explain what contact tracing is and what that procedure kind of entails? The question is, what type of tracing does the health department do to follow up on patients once they test positive?
Sure. So when we receive the test result that someone is COVID positive, we call that patient. Sometimes that's not a possibility depending on if they're in the hospital, if they are unable to speak to us. But most of the time we are able to contact that patient if they are in their home. We talk to them. We find out when their symptoms started, what type of symptoms they had, where they had been in the few days prior to their symptoms starting, who they had been around. And from there, we take, if they have specific names and phone numbers for those people, we take those, we contact those individuals, we find out if they're having any symptoms, have some questions that we follow up with them, and then depending on what their answers are, we may need to take further steps. If they do have symptoms, we may refer them to be tested. If they don't have symptoms, it would simply be basically a quarantining at home for X amount of time to make sure that they, if they are just not symptomatic at the time, that they are not going out and spreading anything that they may have. But yes, we do extensive contact tracing for every patient that is COVID positive by reaching out to those that they have been in contact with.
So Sam, I want to expound on that for just a minute, because that's really that we're going to be faced with that even more as we move forward.
We are.
If a person gets tested positive,
Yes.
and during that contact tracing, they say, "Oh, I was at a big party and there was 100 people at that party." Your job just multiplied 100 times.
By 100. Yes.
So it's not as easy as what you may be sitting at home thinking about, and that has happened. So
It has. And there's a lot of factors that go into it. So when we do contact tracing, the CDC and IDPH has a definition for what they use for close contact. And that is for 10 or more minutes if you are closer than 6 feet apart. So if we have someone that says, I was at a party with 100 people, then we have to go through and find out, even if there were 100 people at that party, did you only talk to 50 of them? And if you talked to 50 of them, was it in a large group gathering where, you may have been around, a fire pit where, you may have had a decent amount of distance, or were you in a close proximity, a close circle? So there's a lot of detective work that goes along with the contact tracing. And as you said, depending on the type of situation and who they were around and what type of activity they were at, it can get exponentially larger in about a 10-second span when we're asking questions for anyone that is COVID positive.
But the people can make that detective work easier if they keep a diary with dates, with names of people that they've come in contact with, maybe addresses. If a person is incapacitated and can't talk after they've been diagnosed, it would be really nice to have a document that you can go back to.
It would. And, for everyone that thinks we are being too strict when we keep pushing the idea of, social distancing and the sheltering in place, that's exactly why. Because, if you are at a party with 100 people, at this point, there's no excuse for that. You have put not only the 100 people that were there at risk, you've put everyone that those 100 people have been in contact with after that point at risk. And the spread of COVID-19 can really happen like wildfire. So that's why we strongly, push socially distancing when you have to be out, or the sheltering in place, because it makes a huge difference in the spread of the disease.
Well, I'm playing the devil's advocate. That's why I think it's so important that these procedures, the social distancing, the sheltering in, because I'll pick on the movie theaters or the drive-ins. If you've got a place that I'm at and I'm tested positive and there's 100 people in a movie theater, I'm not going to know who all those are.
Exactly.
So that even compounds you're trying to figure out.
And in that situation, we don't even have a way of figuring out, the movie theater doesn't take names of people when they come in. And, if we were to put out a public, statement that said anybody that was at the movie theater on this date and that time, then it ensues panic. And, anybody that was not only there that day, but maybe the day after. So, I understand how hard it is to be at home right now and how hard it is to be limiting our activities. But trust me when we say we can't wait for life to get back to normal as well. We are right there with you. I cannot tell you. I am ready to get a haircut so badly. We want to get back to normal just as much as you do. But with these restrictions and, the socially distancing and the sheltering in place, it really is for the greater good of the whole county. The quicker that we can slow the spread of this, the quicker we can get things back to normal.
Very good.
Sam, another question that's come in here for you today, and with our pending numbers really jumping today, I think this is a pretty relevant question. How long does it take to get a test result back?
So it really depends, as we have said in the past, that as we open up more testing sites, the turnaround time for results is going to be longer, but anywhere between 2 and 5 days is the time frame that we're seeing right now, from when the test is done and sent to the lab. 2 to 5 days after that is what we're looking at.
And you're seeing that number go down. When it started out, some people it was 7 to 10 days.
It was. And the Illinois Department of Public Health labs are working 7 days a week, which has been a huge help. We are turning around test results quicker because we're seeing the need. If you live at home with others in your household, sometimes people need to make arrangements to stay somewhere else. And it depends on waiting to get that test result, positive or negative, on how you keep your family safe. So IDPH and some of the public labs that are doing testing now have understood the need for urgency for these test results. So they've been a huge help in making the turnaround time quicker as well.
Another question that just came in now. What type of new symptoms are being added to COVID-19? In the beginning, we heard fever, dry cough, and shortness of breath, but there's other symptoms now.
There are, and it's really expanding the range of symptoms. Now we are hearing some gastrointestinal issues, so vomiting, diarrhea. We've also heard that some of the doctors have talked about when they've been on the loss of taste, the loss of smell. And I think it depends on the individual. If you have any underlying health conditions, your symptoms could be exacerbated. They could be a little stronger. If you're a relatively healthy person, your symptoms could be more mild. And as we have said from the beginning, if you have mild symptoms, we're not necessarily testing those that have mild symptoms. So if you do have mild symptoms, you should be self-quarantining at home to help prevent the spread of this.
Okay. Another health department related question that came in is,
Sam's popular.
why are some nursing homes being reported when others are not?
So the way it works with reporting a nursing home in outbreak status, they have to have 2 or more, and those 2 can include either staff or resident with either a COVID positive test result or COVID-like symptoms. So if they only have 1, whether it be a COVID positive result or symptoms, we wouldn't report that. We have to have 2 or more for it to be considered outbreak status. And then at that point, from there forward, they are considered outbreak status.
And to further expound on that, just to clarify, when they're declared outbreak status, then they essentially have different procedures that go into place in basically treating anybody in that facility with a type of symptom to be considered positive.
That is correct. So when we have a facility that is in outbreak status, and all of our long-term cares and congregate living settings have done a great job. For several weeks now, they have not allowed visitors in, which is strictly to protect the health of their residents, because a lot of the residents that are in long-term care facilities and congregate living settings have some underlying health conditions. So the limit of not having visitors in is simply just to protect them. But they've been taking those steps from the very beginning, doing health and wellness checks on their staff when they come in for a shift, that being temperature checks. Some of them have even gone so far as to have a separate area for them to change from the clothes that they wear into the facility, change into the scrubs they're going to wear for work, and then at the end of their shift, change out of the clothes that they wore to work, and then change it back into clothes that they can wear back home to their families. So, they've really done some above and beyond measures to help keep those residents safe.
Okay, thank you. Chairman, I got one here for you. Next one come in is, I was curious as to why our county seems to have such a high rate of COVID compared to anywhere else outside of Chicago, and when will we expect to see our peak?
So the medical community told us to expect the peak to be somewhere around this weekend. We won't know if that's true until we get into next week and see what those numbers are. You really aren't going to know how our rate compares to anywhere else until after we're through this. It very well could be we won't know until much later in the year, when this virus and its spread has subsided, what the real numbers are. But right now we are seeing this area has the most COVID cases of anywhere south of the collar counties. There could be several reasons for that. One, we've added a lot of new testing sites in St. Clair County, so now I believe we probably have more testing sites than about any other county around. Also, you got to remember that 33% of the people who work in the downtown St. Louis Central Business District come from Illinois. So we are really a region dealing with COVID-19. And that's something to wrap our heads around. That St. Louis County, those are all giant areas. We're connected by Metrolink. The train runs like a ribbon through all of our area. Those connections are significant, and they also can be part of the reason why this exists. You really can't look at population. Look at Randolph County. It's an eighth the size of St. Clair County, and yet it has about a fourth the number of COVID-19 positive diagnosis. They'll find out at some point where that spread came from, or at least they'll speculate as to where it came from, but we're not really going to know what the real number is and how significant that spread is until after this is over. What I do know is that by people staying home and doing what they're asked to do as far as social distancing and hygiene is going to make this number lower. You're going to allow us to be able to control this spread and keep that number at a minimum. If we hadn't been doing what we've been doing for the past month and a half or 2 months, these numbers would be exponentially higher. One person can infect 3. And so think about what that spread would be by now. The numbers would be jumping and jumping. It jumped 100 this week, more than 100 the week prior. That jump is really the sky is the limit if people really violated the executive order of the governor.
Okay. Thank you. Now we're joined by St. Clair County Regional Superintendent of Schools, Susan Sarfati. Susan, as is every week, we get questions about the school system. And this week, one of the questions that came in is, will the school still collect materials at the end of the year, as there is uncertainty as to whether there'll be in-person classes starting in the fall?
Yes, on Friday afternoon, the State Board of Education released guidance to the school districts about how to pick up materials and drop off materials for the districts and for students. So school superintendents and principals are this weekend and early next week going to be deciding how that best works for their particular situation. Many of our districts are going to wait until closer to the end of the school year when e-learning or remote learning stops so that they can collect Chromebooks or tablets or iPads. They need to do that over the summer so that they can clean them up, add any new software for the next school year. And there are textbooks that have been sent home, library books that have been sent home, but there are also things that have been left in the classroom that need to go home. I'm hoping we don't have a lot of lunch boxes that have been left, but there will be a process that each school district will communicate to their constituents, to their students. I do know that one thing is that one person at a time will go in. So if you have a kindergartner, they probably aren't going to be able to carry a big bag of things home. So the parent may have to come in. The recommendation, though, is to do curbside pickup. So Dr. Tron Young was here yesterday, and he and I were talking, and they've already talked about having stations where you drop off your electronics at one station and your textbooks at the next station, and then you pick up your bag for your particular student without ever leaving the car.
So every school district's going to be different, but they're all definitely working through these processes on a daily basis.
Correct. The State Board of Education gave about 10 points for the districts to follow, but it's going to depend on how your parking lot is set up, how many students you have, the variables from each district, how old your students are. Those variables are going to change from district to district.
Thank you very much. Director Simmons, a question that came in here on feed today is there any National Guard activation in St. Clair County, and particularly will there be any related to long-term care facilities?
We have had for the last month 2 National Guard members deployed here at the EOC, helping us with some logistic work. Any of the additional requests for that would come through any new programs that would be set up by the executive order. Right now, we haven't been made aware of that. We're going to be opening up another test site. The chairman and I are going to a meeting tomorrow, and I'm not sure what's all going to come out of that, but they're readily available if we would need him.
Okay. Another question that's just come in is people seem confused about where they will be required to wear masks. Is the assumption based on the governor's release that every public business or public setting, or is it just limited to certain places?
I think from what I've seen and heard, and again, we're waiting for that final order to come, but I think it's recommended that it's going to be required that any place that you can't maintain that 6-foot distance, So wherever you're going to be going, I know at the courthouse, if and when that gets opened back up here soon, it's going to be a requirement there. A lot of the grocery stores are requiring it now. So I would say that if you haven't got your mask, you need to be looking for one.
And we receive a lot of questions about if I can't find where to buy one, etc. We just posted some information again today on that.
That's correct.
As far as
Through the CDC recommendation.
how to make your own mask at home using a T-shirt or a bandana or various things you would have around the house, because the governor's requirement is not a specific type of mask, it is a face covering.
It's a face covering, that's correct. In fact, when I came in this afternoon, one of our telecommunicators was telling me that she's made quite a few of them for friends of hers, so everybody's preparing for it.
Very good. That concludes the questions that were submitted, and I think we've gotten everything that's come in. A lot of good following, a lot of good comments again today from the followers. Very appreciative of the information that's being relayed.
Well, and we appreciate all the questions that on Sundays that we do here. Just to recap real quick, you heard the numbers that Sam gave us today, 2,126 new cases from yesterday, 59 deaths in the last 24 hours. We've had 7 new positive cases here, and we want to just really make sure you understand that don't get misled by those numbers. Sam explained that, testing, the way it's done, I thought we had a good question and answer here. And we read each and every one of your questions that you leave, whether you want to believe that or not. Sometimes we're up to 1, 2 o'clock in the morning doing that because that's how important it is to us to hear your feedback. And I just can't ask you enough. We all have a duty to help put this thing behind us, and you asking those questions tells me that you're sincere about it. Now what I'm asking you to do is to share this to your friends and family. We need to get the word out that we are doing these briefings, and if you want to get the up-to-date information, this is where you can get it at, along with whatever other news channel you want to listen to. This is what we're doing here to keep our citizens updated. Now please do me a favor, share it and let everybody know what they need to do, and that's to stay home and to stay alive until we get this thing behind us. We'll be back tomorrow afternoon at 3:30 for the next briefing. We'll be back momentarily with Cindy to translate this into our Spanish community. Thank you very much.